Well, welcome back to another week's analysis behind the news. It's interesting that both the New York Times and the Wall Street Journal have carried an opinion piece on their editorial page about Romneycare. And apparently the state of Massachusetts is obviously running out of money, like most states. And one of the things that's driving the red ink sky high is Romneycare, just like Obamacare will do to the economy once it's fully implemented as well, if it is ever fully implemented. The interesting thing is that they're coming up with a new 11-member board to sort of monitor now what's going on. It's a new bureaucracy that they're adding in the state of Massachusetts to start to regulate the doctors and the hospitals, et cetera, on top of all the regulations and boards and everything else that they've already got. It will do this to both public and private medicine. What this means is, as it usually means when you have such a government program, is you don't get the operation, or you're standing in line too long for the operation and you die before you get it. You don't get the examination, or you're just simply too old, sorry, go home, don't worry about it. That is what has happened in Canada, England, Belgium, the Netherlands, Germany. Anywhere you have this sort of a healthcare system, it always costs too much. It's free, as they say. It comes out of everybody's pocket. It's not free, obviously, but since it is, in the sense, free from the standpoint of you can go and get this service and it doesn't cost you any more, basically, than what comes out of your paycheck, then everybody goes to the doctor for everything. And it puts a tremendous burden on the system. At any rate, now to curtail the costs of Romneycare, they're having to build new bureaucracy. So we'll see how that pans out. The thing about any kind of health care is this. We have to socialize our health care in order to merge with Canada and Mexico. We have a free enterprise health care. It is not socialized. They are trying to socialize it, state by state and federally through Obamacare. Canada already has a notorious health care program. The powers that be that want to merge Canada, the United States, and Mexico into what has been nicknamed the North American Union need a socialist system over our health care in order to merge these things together. That's the importance of it, and that's why they will never quit trying to put it through until we kill the whole idea of losing the independence of the American people and protecting the Constitution of the United States. Another article that I found interesting in light of what's going on in Africa as well is an article in the New York Times yesterday about Rousseff, who is the president of Brazil. Now, you know I've talked about BRICS a lot on these broadcasts. BRICS, Brazil, Russia, India, China, and South Africa. And I've tried to explain that these are led by communist governments. Most people do not seem to believe that yet. But Rousseff, here's a picture of her when she was 22 years old, under arrest, as in the caption it says, as a member of a guerrilla group. She was the head of a communist terrorist organization that wanted to go out and kill people, blow them up, et cetera, but she's just this innocent little thing like Bernadette Dorn was in the United States. It's tantamount to this guerrilla leader becoming president of Brazil, like Bernadette Dorn becoming the head of the United States. That's really what's going on. This is a major article about what's going on now in Brazil relative to going out and accusing all of these anti-communist military leaders of being very draconian, torturers, et cetera. They may have been. I don't know. All I do know is this, is that they're moving now to eliminate these people out of the military. Any opposition within the country to their communist rule will be systematically terrorized out of doing anything, and if they can't be terrorized out of doing anything, they will be done away with, as they are starting to do in South Africa. Out in the rural areas, in the farmlands, They are starting to have a lot of terror, murder, rape, grisly things done against the Boers who are in South Africa. Just like Mugabe did in Zimbabwe. It just ruined and devastated the farming in Zimbabwe, the old Rhodesia. This is what will happen in South Africa. It has gotten to the point where civil rights organizations, international civil rights organizations, are starting to look at South Africa saying, wait a minute, all these steps that lead to genocide are already becoming a problem in South Africa, particularly the demeaning process. The demeaning of individuals and races always preclude their elimination. It is a psychological process that's done on individuals, not so much the individuals who are the targets, but the individuals who have to carry out the orders of the government. I don't want to spend too much time at it. It's just that you have to believe that the person that you're killing, the person you're torturing, is beneath you. That helps salve your conscience as you do it. So they start the demeaning process. The Jews are inferior, that kind of thing, which led to the elimination of the Jews. Now all of a sudden the white farmer in South Africa is being demeaned, there's too many murders, too many things going on there out in the rural areas, quite away from the cities, so most of the South African citizens don't really know what's going on yet. They want to live together in peace. But out in the rural areas, in the farms and the ranches, is where the violence is beginning to take place. Not beginning, it's been going on for quite a while. But at any rate, it's reached the point where it's becoming quite obvious that it's a government policy. We know that the war on terror, as all wars we engage in, produces more terror. Now we see Al-Qaeda in Spain. Last week it was in Mali. The week before it was in Yemen, etc., etc. So now we're finding more and more terrorism through Al-Qaeda everywhere. And of course, if they know it's Al-Qaeda and that these people are in communication with each other, and they have to be in communication with each other to be Al-Qaeda, right? Otherwise they'd be something else. They would be independent. Well, then you have to ask the question, with all the vaunted security that NSA has and everything else, why aren't they able to intercept all this means of communication? By the way, on the same page, there's an article in China where a teenager, he gets upset because he got in a fight with his girlfriend, so he goes out and stabs 8 people to death. It sort of reminds us of other individuals in the United States have used that excuse to go in and kill them with guns. Well, this guy used a knife. So it isn't a matter of banning guns. You've got a few nutcases out there that do crazy things. They'll use any weapon at hand to do it. You can ban everything, and they'll go out and use maybe pantyhose to strangle somebody to death. So if somebody did that with pantyhose, would we have a national campaign to ban the pantyhose? I don't know. You women are going to have to settle that one. I can't. But at any rate, here we see more and more defections from Syria. Diplomacy has hit a dead end there. Here's a picture of a government tank that's been destroyed by the rebels. And no one seems to be asking, where are these rebels getting all this heavy weaponry? Where are they getting the training? Who's coming into the country? And by the way, that's what's happening, is that people are coming into Syria to overthrow Assad. Assad may be a bad guy, but there's something else going on here. Somebody's financing this. Somebody is coordinating this. We would like to know who it is. We have a suspicion, but we don't want to get ahead of the evidence. But just kind of think about those things when you read these headlines. If these rebels are able to stand up to the army, who gave them the wherewithal to do that? Until next week, we'll see you then.